A psychiatric treatment with a history of controversy.
Electroconvulsive therapy, or ECT, is portrayed in movies as inhumane, but a Nash County woman credits the treatment in its modern form with saving her life.
Tonight, CBS 17's Maggie Newland takes a look inside that treatment room with a closer look at ECT.
And Sharon, not much for a headache last time around. You did okay?
Once a month, Sharon goes under anesthesia.
See you when you wake up, okay?
To get a pulse of electricity to her brain, powerful enough to cause a seizure.
Ready? We're treating. Treating now.
She's one of about 100,000 Americans receiving electroconvulsive therapy, something she considers her last hope in fighting debilitating depression.
This is one of my favorite pictures right after I became a mom.
For much of the past 2 decades, that depression consumed Sharon's life.
Every medication would eventually fail me. I love my son more than anything on this earth, and there were times that I couldn't be there for him.
I mean, you don't know what to do if you've never dealt with depression or anything, and I'm trying to help her feel better, and some days, I don't care what you do, nothing's going to work.
Eventually, she saw just one way out.
I became suicidal. I felt like it was the most logical thing to do. I had tried everything.
But before she went through with her plan, she turned to her family and her doctors.
My doctor told me that we had done all that we could do. It was time for me to consider ECT. And I burst into tears. And I was very afraid.
It does work when other things don't.
Dr. Jacob Feigl is the medical director of Duke's Electroconvulsive Therapy program. He says ECT is an option for patients with treatment-resistant depression, meaning multiple other approaches have failed.
It involves placing electrodes on the scalp and inducing a medically controlled seizure under general anesthesia.
Patients receive the treatment several times a week until they enter the maintenance phase, getting it about once a month.
Gonna go ahead and put this cuff on your leg.
Unlike when ECT was first used decades ago, medications now relax a patient's muscles to prevent injury during the seizure. A cuff stops that medication from getting to 1 foot, and we can see it move.
There, now the seizure is done.
The whole process from start to finish takes about a minute and a half.
And that's it.
Within the hour, Sharon is headed to lunch.
I feel pretty tired and I have a migraine, which is not unusual.
But emotionally,
I feel really good right now after my treatment, and I just feel much better than I have the past few days.
her biggest side effect is memory loss. Several times a day, Sharon struggles to remember words and has completely forgotten an event she attended.
David and Elijah were there with me, and they talk about it and remember it. I don't remember it at all. That I hate that.
It's a possibility every patient must weigh, but Sharon and her family aren't looking back.
Is it worth getting the ECT despite losing some memories?
Oh, absolutely. I could lose my life or my memories, and I chose to lose a few memories and continue living.
Maggie Newland, CBS 17 News.
Now, memory loss is one reason that ECT is considered the most controversial psychiatric treatment out there.
So despite those side effects, the American Psychiatric Association, the National Institute of Mental Health, and the National Alliance for Mental Health all reference ECT as a valid treatment option for people with severe treatment-resistant depression.